أعوذ بالله من الشيطان الرجيم. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. And welcome to your favorite Peter Marisburg Pulse show on your favorite radio station. We are 90.4 and 105.6 FM. You're connected with Shubnum Ismail, keeping you educated on medical matters on this Mubarak Saturday morning. Providing care in the comfort of one's own home can make all the difference for patients dealing with serious illness or complex medical needs. So, home based palliative care, wound management, and support for chronic conditions like kidney disease are just a few areas where specialized care can generally improve quality of life. So this morning we are speaking to Fiona Booysen, a dedicated registered nurse with just over 30 years of experience in clinical care. Welcome to the Pulse Show, Fiona, and we're great to have you on the studio today.
Thank you so much for having me, Shubnum.
Some background insight, listeners, to our guests. So, Fiona provides specialized nursing services with a focus on advanced wound care, renal education, and palliative care, delivering patient centered care both home and community settings. So, her background includes extensive experience in nephrology nursing and dialysis services, having managed and established renal units and supported patients with chronic kidney disease through education, treatment, and coordination and ongoing clinical support. So, in her private practice, she works closely with doctors, allied health professionals, patients, and families to ensure continuation of care and dignity through all stages of illness. Fiona is known for her compassionate approach through clinical judgment and commitment to holistic care. So, particularly patients with complex medical needs and those requiring end of life support. So, we're going to drive straight in. Fiona, can you tell our listeners what is palliative care?
Okay. Good morning to all the listeners. Palliative care is improving quality of life for patients that are in stage. And the focus would be on pain management and the symptoms, emotional support, spiritual care, as well as practical support.
In terms of the benefits of palliative care, what are the stage of illness the patient will probably get to see you?
It will definitely be in end stage. So most of the time it will be stage 4 for all your cancer patients, stage 5 for kidney diseases. We have HIV patients that are also managed with palliative care, as well as a lot of neurological diseases.
In terms of your programs, how can palliative care improve the quality of life for a patient and their families?
Palliative care takes out the stress for the patient and the family. Everything is done in the comfort of their home. They don't have to worry about rushing to the next appointment. It's comfortable for them. They have caregivers at home that watches over them. And it really just makes life easy for everybody. The stress of having to go for harsh treatments just makes it so much easier. If they make the decision, we've had enough now. And it's time to just make new memories, be at home, and be comfortable.
What are some of the common misconceptions of palliative care?
There's a lot of people that think that palliative care is killing the patient, that they go home just to die. And that is a huge misconception because most people, when they decide we've had enough, a lot of treatments are very, very harsh. They give their bodies time to recuperate, they give their bodies time to relax, and people actually then just relax and have a way better outlook. They're not stressed, they're not fighting. The financial burden also becomes less because you don't have to worry about transport to and fro on a daily basis or on a 3 weekly basis. So that actually helps as well.
And how can medical professionals integrate palliative care before their patients into some of the programs? You deal with a multidisciplinary team, so you obviously see the patients when they're in acute and also follow them into possibly maybe a rehabilitation setting. What advice will you give to those medical professionals?
When patients are normally diagnosed, they see a specialist in that field. So for kidney disease, they'll see a nephrologist. For cancer, they'll see an oncologist. But we have these amazing palliative doctors that are on the sideline there. If we integrate those palliative doctors, it makes life easy. They're on the ground. The patient has access to them. Most of the time, patients are given 6 monthly appointments. And in that 6 months, they have nowhere to go. Whereas they have that palliative doctor that they can call on. Most palliative doctors will even allow you to have their phone number and you can contact them at any time. So I think if palliative care doctors are brought in at an earlier stage, then the patients will have a better option as well.
I hear you, and I had a friend that actually had a palliative patient at home, and it was really nice to see that some doctors do home calls for the convenience of the patient and able to give them a report. It is quite an emotional journey for a family member, to obviously hear that your family is going through palliative and you need to actually plan ahead. And what is the role of family in palliative care and the decision making? Why would you consider it being important?
Shared decisions are very, very important because You can collaborate on treatment options and care plans. You have advanced care plans, which is very, very important in palliative care. So, discussing that for future care and wishes. And they also have directives to sign to say, please, we do not want any miracles taking place. So, the advanced care plan is very, very important. The symptoms management and as well as the family involved, because if the family is involved, the loved one's decision making becomes way easier.
And tell me, do you see a lot of your patients that undergo pain?
Lots of pain, but there is lots of pain management options. So once again, the palliative doctors are on hand with palliative care nurses in the home setting. You have hospice, for instance, that's also involved with lots of pain management. And for patients that can't afford it and it's not on medical aid, hospice actually provides pain management. They set up syringe drives and they have the patients in their homes with pain management.
Special mention to all those organizations out there, Jazakallah, for the work that you do behind the scenes, for example, hospice, etc., that can still assist with palliative and give love to the families and the
Because
support
it's all
that's
free of
necessary.
charge.
Yes. Can you elaborate a little bit about your organization and what sort of support does it supply to families?
Well, we support, I work with a company called Aligned, and then they send us to the patients that can have palliative care at home. But my personal organization, we provide caregivers, and the caregivers go into the homes when the patient's family has to go to work. They can go to work knowing that there's somebody that's going to take care of their family members, be compassionate. They don't have to worry. They are all qualified caregivers. We have contact numbers with medical aids. We have contact numbers with the ambulance services if anything goes wrong, to get them to the hospital quickly. And we are just there as a support system so that if ever anything happens, we are available.
A lot of emotional emotions go through the patient during this time. How does your organization handle the emotions and deal with the support factor for the families?
We actually have counselors on hand as well that will come out and speak to the families on how to deal with the emotional side of it. They also go in and speak to the patient himself. They have counseling sessions for the families together so that they can deal with it together. And they are available once a week. They are available telephonically. They do home visits, whether it's after hours, but there are counseling available for all the patients and families.
So you don't work independently. Do you deal with other organizations besides hospice as well?
Well, as I said, I'm contracted to Aligned, and then they refer patients in the palliative sector to us, and we do home visits for those patients. Hospice refer patients to us. We refer patients to hospice. But other than that, I work independently.
You've been around in healthcare for a very long time, Fiona. So, can you tell our listeners, or in your opinion, would you say there are some challenges for the elderly in South Africa?
Absolutely. You know, the elderly are being sidelined. I looked at a room full of elderlies the other day, senior citizens, and I thought to myself, this room is full of talent. And none of us actually look at it in that way anymore. Talented ex retired doctors, talented bankers, talented seamstresses. And we tend to just overlook all that talent that is just sitting there. If we start looking at it from a different perspective, we can actually use all that talent because most of those elderly people are still fit. But the challenges that most of them are facing, I feel, is especially the ones that are getting SASA grant, poverty, transport issues. Most of them don't have their own cars and they have to make use of public transport. They have to use that little bit of that SASA grant to use it on transport. So I think from that perspective, and I read an article which says only 23% of the elderly people have access to medical aid. So what about the other 77%? They have to use government facilities. And most of the time, the government facilities don't have the resources. So I think that's the challenge for elderly.
I agree with you. I tend to do some work in the public sector, and especially in the MOPD, the waiting time for some of these patients, they get up early to get out there to see the doctor for their regular checks. And it's unfortunate that they have to wait for such a long time, sometimes a whole day, if they have to get through to pharmacy to collect their meds. So I agree with you. I think so. There's a need, especially for Peter Marisburg, that with our population that there could be more clinics or maybe even another public hospital to actually relieve the burden of the numbers that we see. So how can our communities better support elderly residents?
I've been thinking about it for the last few months. I attended a palliative care congress last year. It was an international one in Durban. And there was a gentleman from India. They have a voluntary system in their area, so say Peter Maritzburg. And he set up a voluntary system for the elderly.
Hmm.
There's no money involved. So if there's payment expectations, that's not going to happen. It is a free voluntary service where you look after the neighbor next door, the elderly next door to you. And in that area, you look after five. And I think that's how we will overcome the challenge with the elderly. If we all take responsibility, maybe for five elderly people, I think we will win it. But it has to be on a voluntary basis.
So you see things from falls and different kind of ailments under the umbrella of elderly care. What's some priority care packages you'll advise our listeners to look into for their grandparents or mom or dad?
So I've also been thinking about that. If we can arrange for pop in services, let's say you leave for work at 7 o'clock and you're leaving your elderly parent at home. If we have somebody pop in between 7 and 8 to make sure that Granny's got up, she's had a bath, a sister actually with a bath and a shower, make sure she had a breakfast and she's seated and comfortable. And then maybe later on during the day. So if somebody could pop in 3 times a day, you know that you are eliminating all risks from that elderly person there, as well as even just a telephonic service. Let's say she's sitting there at home and she suddenly has an emergency. Just like how we have 911, we could have a telephonic service where she can call and say, "Hi, I'm Mrs. So and so. I live here and here, and I have an emergency. Please, can somebody come along?" Or, "This is my need." And then we send out somebody to help her.
The next question is a bit of a sensitive one, but its reality is social isolation. Elderly often not checked, modern kids, they want to go out, socialize, and there is that neglect of, they're not, that attachment is detaching. What advice will you give our families out there to make an impact to our elderly health, and what social conversations and how can they maintain those relationships?
Lots of elderly are lonely,
Yes.
and the loneliness is getting worse. What I've discovered over the last few years is it is just mom and dad left. Kids have all immigrated. There's absolutely no support system for them. So if we can create somewhere where we can take them out on a weekly basis or even just have a center. So if we can have care centers where this family, it's just mom and dad there, nobody else. You can go and pick them up on a Thursday morning, have a care center where they can have exercises, communicate and integrate with their own senior citizens. And I think that would alleviate that loneliness and that social isolation. But the idea is to get the funding and set up these care centers. And then once or twice a week, you bring them in, exercise, sit around, and just interact with one another.
Inshallah, we hope there's going to be more care centers across the province. For Pietermaritzburg, I know there's PAFTA and they do some wonderful work, outings and educational programs, and pretty much well some wellness screenings as well. So, listeners, you're tuning into Radio Al Ansar on this Saturday morning on 90.4 and 105.6 FM, where the vibes are always positive. And today we have Fiona, a registered nurse with over 30 years nursing skills. So she's sharing her knowledge to improve our family's journey through the stages of complex medical diagnosis. So stay tuned, and we're going to be right back after this short break. Assalamu alaikum wa rahmatullahi wa barakatuh, listeners. You have just tuned in into Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM, where the vibes are always positive. I'm your host, Shubnum Ismail on the Pulse Show. And our discussion today is on home based care for patients with complex medical needs. We have Fiona Booysen at our Peter Marisburg studio, and we're going to dive straight in. Fiona.
Hello.
Assalamu alaikum and good morning to the Pulse Show.
Thanks, Shubnam.
It's great to have you with us.
Thank
So,
you.
Fiona, can you tell our listeners what's the role of technology in improving elderly care?
Technology.
Yes. In terms of vitals, do you think that it's impactful to actually have regular checks and to obviously incorporate technology and its advancements for the elderly?
Well, we can do lots of checks. Um, I don't know. It won't be home based as such. They'll have to go into for technology. The basic technology at home would just be your basic blood pressure machines and glucometer machines and maybe a cholesterol. But for further technology, they would be advised to go to a hospital setting or a doctor. I think that would be a different scenario altogether.
I know you spoke earlier about keeping yourself up to date with improvements in healthcare, and you've been to conferences. What is the latest trends in terms of palliative care and home based care when it comes to your training and development?
There are so many training available. There's a company called Paltrack, and they have so many free caregiving courses, free palliative care courses, and anybody can go onto their website and do it. And it is amazing at how much you can learn. And they are so innovative and they are so dynamic out there with everything that they are offering. And they have amazing doctors and nurses that are running that program. And it's free. Palliative care courses that are being offered. Anybody can go onto their website and do it.
You know, Fiona, when it comes to palliative and frail care, quite often you hear families saying, I got to be at work, I've got my mom at home. It's challenging that, I cannot see to her 24/7. So, what advice you have for families to balance caregiving with their own personal needs?
Lots of families are taking financial strains now. And to balance, it's very difficult to find a balance because you're stressing that the person you've left your mom with is not really going to take care of them properly. So, my advice would be that they're going to have to trust the person that they're leaving at home. And while they're at work, just be reassured that the person that they left, otherwise, it is going to be an emotional strain on them. Weekends, they need to go out. Life doesn't stop because everything else. We have to find a balance and still go out and have fun. I would suggest that the family members go out weekends and take along Granny to the beach so that there is some form of relaxation that takes place.
And what are benefits of intergenerational connections for the elderly?
Well, with that, we're going to have to look at the community support once again and see and encourage families and communities to become involved and build stronger connections because if the community is not going to help families, then everything is just going to fall apart. So we have to come together as communities and support one another.
Correct. And how does elderly nutrition impact health outcomes?
Oh, that is one of the biggest outcomes because if they become malnourished, they are more prone to be hospitalized. If they become dehydrated, they are more prone to have complications. And if they become nutrient deficient, it will actually impact their bones and their muscle masses. So we have lots of risks of falls in the elderly. So nutrition does play a large role. And it can also eliminate hospitalizations, which become costly.
And you obviously deal with patients with Alzheimer's, dementia.
What a sad situation. But yes, we do. The family takes a lot of strain, but we do deal with a lot of Alzheimer's and a lot of dementia. And it's a challenge looking after them. But once the stages progress, it gets better. They get very anxious. But once they start trusting the caregiver, it gets easier and easier.
With your experience, what activities promote mental and physical well-being in the seniors?
Exercise, um, swimming. I have some ladies that go swimming every day for an hour, brisk walking. Woodlands Community Hall, they have a lady that goes and picks up the elderly at the community, the old age home there, Isabel Beardmore, and she takes them and they do an aerobic class, exercising, just to make sure that mentally they are challenged, reading, puzzles, and if we can have the municipality they have a mobile library. If they could go around to all the old age homes, which I think they do, then we can encourage people to read.
I had an interaction recently with an organization, and I like to actually plug the suggestion that if your child is mature enough, you can go and volunteer at these old age homes because sometimes the elderly would just like to connect and talk to someone. You can read a story, or you can help them tidy up their room, or do little things to still make them feel loved and cared
That's
for.
an amazing idea.
Yes. And how can we ensure elderly people access necessary healthcare services? I know sometimes they worry about finances and going to an acute hospital and large bills. So, in your experience, I know that healthcare, we got to make that more affordable, and NHI hasn't kicked off yet in South Africa. But what can we do, Fiona, to try and make it more accessible?
I was thinking if we could have transport services because most of the elderly don't have transport services. Most of them can't jump in the public service transports that we have. So if we can avail transport for them to get to the medical facilities, that will alleviate one problem. If we can create awareness for them to know where the closest facility is to them so that they don't leave point A and travel 100 kilometers to point B when there is a clinic around the corner and they haven't even been aware. So, awareness programs as to where the closest facility is to them, transport made available to them. I think those are stuff that would help and encourage family support because the families tend to neglect the elderly.
And that's reality,
Mm.
unfortunately. Listeners, let's reconnect after a sheet break. Stretch your feet, don't go too far, and we will be back soon to unpack more information about wound management. Assalamu alaikum wa rahmatullahi wa barakatuh, dear listeners. You have just tuned into Radio Al Ansar 90.4 and 105.6 FM here in Peter Marisburg, where the vibes are always positive. So I'm your host, Shubnum Ismail, and we on the Pulse Show. So our discussion today is on home-based care for patients with complex medical needs. We have Fiona Booysen with us in our studio, and we're going to dive straight into the next segment, which is on wound care. So, Fiona, it's great to have you on the show with us today.
Thank you.
Can you tell our listeners what are some of the common types of wounds requiring specialized care?
Okay, so we have lots of wounds. We have the diabetic foot ulcer. We have arterial ulcers. We have venous ulcers. We have your pressure injuries. Those are the bed sores that patients get. We have surgical wounds that don't heal. We have severe burns, wounds with exposed bones, tendons, infected wounds, and wounds that have significant tissue losses. Those would all require advanced wound care.
And how can pressure ulcers be prevented?
Pressure ulcers can be prevented by assessing your patients. There's lots of tools out there that you can use. I'll just use the Norton scoring, where if you look at the patient, look at their age, their skin sugar, nutritional status, and then you'll decide. Most of the time, if they are long term bedridden, you would do 2 hourly turns, do skin care, moisture the skin, hydrate them, and that will prevent pressure injuries.
So tell us, Fiona, how does nutrition impact wound healing? Sometimes you hear patients saying, I'm diabetic, I've just bumped my foot, and the anxiety and the worry of getting it sorted sometimes ends up being gangrene. Can you just elaborate about the nutrition side of things?
From a nutritional point of view, we have protein, which is for your tissue repair and growth. We also got to be wary with the protein advice. Patients must only increase their protein if they are allowed to or can, but they are easy protein based, um, like your egg, your albumin, that's pure protein and it's safe for your kidneys. But protein intake increase will heal wounds. We have vitamin C, which boosts your collagen synthesis. We have zinc, which supports your immune function and tissue repair. We have vitamin A, which promotes epithelialization. And we have calories, which provide energy for healing. So, adequate hydration is also crucial because it improves your tissue. Malnutrition can slow down healing and increase your infection risk and lead to complications. So, it's important that we actually get them to eat a well balanced diet.
So, Fiona, you deal with different dressings for different types of wounds. Would you like to elaborate about that?
Well, the dressing selections is very important. And in this new era, you have a vast selection of dressing changes. So, good dressings and the selection, you would use these following criteria and more if you want to protect the wound, is to shield it from bacteria and trauma, maintain a moisture balance, is to promote healing, to manage the exudate, to prevent maceration and drying out, support debridement, is to help remove dead tissue and to minimize pain and trauma when you are removing the wound.
So, through your palliative program at Fear Nursing, you obviously see some of the patients with wounds that you also treat and manage.
So in palliative care, you have what they call fungating wounds, and they rarely heal. So it's a maintenance wound that you are going to look after in the palliative care phase. But in a normal wound setting, the outcomes are amazing.
And obviously, in terms of palliative, is the rotation of the patient to prevent things like bed sores. Do you see that often?
Bed sores are often seen not necessarily in palliative care patients, but in patients that are elderly, bedridden, long term ICU patients. They can even get bed sores from the ventilator. If they're not careful, it can cause pressure injuries on their noses, on their chins, on their cheeks, sorry. And So pressure injuries are avoidable if we really look at the patient holistically.
Can you tell our listeners how often should wounds be assessed and documented?
So wound assessment and documentation should happen at every dressing change. You have to evaluate the progress and adjust care as needed. Some wounds will be done daily. For instance, the palliative fungating wounds you have to do daily for acute wounds and high risk of complications. Then you have some wounds that only need to be changed every 3 to 4 days. And if they're very stable, you can leave it for weekly, but it is as needed that you would change the wound depending on the exudate. But documentation has to be done immediately and with every dressing change.
I hear you, and I hope listeners you are taking notes. And how would one know when a wound is infected, Fiona?
There's very, very marked indications when the wound is becoming infected. The patient will tell you that there's an increase of pain and tenderness around the wound, redness and swelling around the wound, warm and hot to touch, pus and discharge, yellow, green, or foul smelling, fever and chills, and delayed healing. If you suspect that there is an infection and you need to call your wound care nurse or go to your doctor and make sure it's treated immediately.
Are there any new updates or innovations with wound management?
Oh, there's so many. Um, there's all these smart dressings that you can use now. Um, there's bioprinting, there's electrical stimulation therapy, there's gene therapy, there's nanotechnology, and you have your advanced wound care materials, which are amazing.
What advice would you give to our caregivers with dealing with wound management?
For caregivers, I would tell them to make sure that they actually on top of it. Um, Health education is also important. So we have to make sure that we do health education, and the caregiver, it's their responsibility to teach the patient not to wet the dressing, to make sure that the toes are still warm and pink so that we can see early changes. And that's what I would tell the caregivers.
As we wrap our conversation with Fiona Booysen, we hope you found her insights on home based palliative care, wound management, and renal services enlightening. Fiona, how can our listeners get in touch with you, and any final words for our listeners?
We have a Facebook page. Our company is called Fair Nursing. We have a Instagram page, and we are on several Pietermaritzburg newspapers, Howick Buzz, and they are welcome to call us anytime. And if we can be of service, we will assist them.
Would you like to share your number on the show?
My cell phone number is 082 304 7356.
Thank you, Fiona. It's been great to have you
My
with us
pleasure.
today.
Thank you.
Listeners, Ramadan is on the horizon. Prepare your heart, home, and community for a month of fasting, prayer, and togetherness. Also, don't forget to tune in to next Saturday for another insightful discussion. As the Quran reminds us, and do good deeds. Allah loves the doers of good. I want you to have an amazing weekend, and may Almighty Allah bless each one of us and lead us on the straight path, inshallah. Jazakallah to our technicians, both Durban and Pietermaritzburg. Have both me and my family and the whole Ummah in your duas, inshallah. It's a wrap from myself, Shubnum Ismail. Assalamu alaikum wa rahmatullahi wa barakatuhu.